Hello, 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 everybody. So, today is the day. This is your last heart video, and we are talking about the health concerns that all of y'all want to know, right? This is Heart Objectives 17, 18, and 19. Right? So, Heart Objectives 17 is describe the effects of exercise on the cardiovascular system. Right? And we talked about this a little bit in the last episode, right? We talked about this a little bit in your last video where we talked about cardiac output and stroke volume. So, we're dealing with exercise here, right? We talked a little bit about your target heart rate and what you would like your target heart rate to be. Exercise overall is good for your heart. When we were talking about stroke volume, we discussed how athletes have one good solid contraction and pump for their hearts, and their heart rates tend to be slower with more time between each heartbeat. And the reason for that was because their heart was beating more efficiently when it did beat, so because of that efficiency, it was also allowing for additional time for the ventricles to fill with blood between each pump. Because the ventricles and the stroke volume could be large, because the stroke volume was larger, the ventricles could hold more blood between each pump, and the heart was more efficient at getting that blood out and pumping around. The heart did not need to beat as often, meaning they had lower heart rates and better efficiency for their heartbeats, right? Same deal. We're talking about exercise now, right? So how does exercise affect your cardiovascular system? In the short term, exercise is going to increase your heart rate rapidly, right? Especially if you're not used to it. If you just arbitrarily decide, I need to get off Netflix right now, I've been cooped up with this quarantine for far too long, I'm going to go run a marathon, and you try to go run a marathon, you're going to feel like death, right? You're going to get a couple blocks from your house. Your heart's going to feel like it's beating out of your chest, and you're going to want to lie down and die. Because if you aren't used to it, your heart rate is going to increase rapidly when you first start exercising as a short-term effect of exercising, right? The reason for this is because your heart wants to provide the muscles of your body with the necessary oxygen and nutrients that are in your blood that those muscles will need to be able to create energy so that they can still do their muscly job and power you forward, right? If your stroke volume is not at optimal efficiency, that means your heart has to beat more frequently to get the same amount of blood going, right? Meaning your heart rate is going to increase. So during exercise, your cardiac output is also increased because of this, right? Once again, remember that cardiac output was stroke volume times heart rate. So your cardiac output is going to go up when you are exercising. During exercise, stroke volume itself increases because more blood is being sent back to the heart due to your muscles squeezing the blood in the veins and kind of milking the blood back toward the heart faster. As your heart fills up, it's going to stretch out. We talked about this with the muscle tissues. And as your muscle fibers are going to stretch, they are going to contract more strongly. Remember our rubber band analogy? Your rubber band flicks people harder if you stretch it out more. Which means it's going to be able to pump more blood at a time. Right? So those are all the short-term things that are happening when you start exercising as you start to exercise. The long-term positive effects of exercise, though, is that over time, these short-term bursts are going to make the heart muscle grow and stronger. So just like any other muscle in your body, if you start lifting weights, your arm muscles are going to get used to lifting. If you exercise your heart muscle is also going to grow and get stronger. When your heart muscle grows and gets stronger, that means it's going to become even more efficient so that it can pump more blood more effectively. And because it is being more efficient because the muscles are stronger, your stroke volume is also going to increase and get better. So your heart rate and stroke volume are going to improve, right? So your stroke volume is going to get more while your heart rate decreases because you are more physically fit and you are making your heart be more efficient. Those are the long-term positive effects of exercise, right? Doo-doo-doo. Right? But there's always something that can go wrong, right? There are things that can go wrong with all of this. That would be Heart Objective 18. Describe significant cardiovascular diseases, including coronary artery disease and congestive heart failure, right? So, you may have an electrical issue with your heart, right? That's called an ectopic focus, meaning there's an abnormal pacemaker that takes over, right? So, if that SA node is freaking out and crapping out on you because you're an 80-year-old and your heart just isn't keeping up the same anymore, and some of these nerves are getting old and damaged and wearing out, and the AV node has to take over, right? You may have atrial fibrillation, but if the AV node takes over, that's going to affect the junction rhythm and the heart impulses and electrical rhythm of your heart, right? And that's going to affect your heart rate. For ectopic focuses, and abnormal pacemakers take over, we want to become normalized, so you will more than likely have surgery and get a pacemaker put in. That way, they will replace the SA node, or they don't actually replace the SA node, they will just hook up wires to your heart, and if one of your nodes of your heart, your SA node or your AV node, skip an impulse, for lack of a better word, the pacemaker takes over and sends a slight electrical impulse to take its place. So it is a split-second temporary way to have a backup. A pacemaker is a split-second temporary way to have a backup plan if your heart starts skipping a beat and messing up. Right? So there's a lot of things that can go wrong with your heart, right? We have a lot of pictures right here. And all of this is diseases of coronary circulation, myocardial infarction. This is the thing that people worry about the most because a myocardial infarction is your fancy medical term for heart attack, right? A myocardial infarction is a heart attack. It can be caused by a number of things, right? So here we have a heart, and notice how this bottom end of the heart looks like black, dead tissue. That could be because further up the artery that leads there, there's a problem. And this area is not getting the appropriate nutrients, oxygen, and blood it needs to continue pumping. Right? This could be caused by any type of various issues. Right? You could just have a supply and demand imbalance alone. So blood pressure issues have caused, for whatever reason, things to fall apart. This is myocardial infarction type 2, right? Right, and just for clarity, a myocardial infarction means you have had a heart attack, right? Because part of the heart muscle is either having difficulties or cannot beat because it doesn't have the energy, so the tissue is dying. An infarction is when the tissue is dying because of lack of blood supply or nutrients. A cardiac arrest means the heart has stopped. A heart attack, or the infarction, means something is happening that is messing with the heart rhythm, like ventricle fibrillation, if your heart just started fluttering, right? Just to make that clear. But you could have multiple things that have caused this. There could be a plaque rupture that's inside one of your blood vessels with a thrombus or a blood clot that is cutting off blood supply. One of your arteries could have spasmed, that's called a vasospasm, or you could have endothelial dysfunction, meaning the artery has burst or collapsed in on itself because it's gotten weaker over time. You may have something called atherosclerosis, meaning the artery has gotten, instead of being flexible and muscular and being able to move, that artery has stiffened over time. And you may have a supply and demand imbalance if the artery itself has clotted and is hardening from all sides. You can tell that during this portion of the artery, because the blood, like it has narrowed, the blood supply that can get through has also narrowed. All of those things could cause a heart attack or myocardial infarction, right? So a myocardial infarction can be caused by a prolonged coronary artery blockage. And the downside to this is areas of the cell death can be healed and repaired, but sometimes when it heals and repairs, it's going to heal with non-contractile scar tissue. Just like any other injury your body sustains, your body can heal some of it with the way it's supposed to, or your body can heal it with scar tissue. Scar tissue basically means your body got a little bit lazy and didn't put as much collagen into the fix as it should have. Scar tissue can be bad because scar tissue is not that flexible. And remember, you want your heart to be able to stretch and expand and contract when it is contracting to beat. If you end up with a lot of scar tissue on your heart from multiple heart attacks, that can be bad because you want your heart to have good, strong compressions and beats and be able to contract well. But if your heart suddenly becomes made of scar tissue or gains a decent bit of scar tissue, that means your heart is not going to be as strong, especially compared to what it once was. Scar tissue is not flexible. It is not the original muscle tissue. That's just the way things work. Because of this, people who have had heart attacks have to work toward rebuilding and regaining the heart muscle mass and muscle tissue. Right? Heart attacks can also cause something called angina pectoris, meaning you generally have a pain in your thoracic cavity caused by a fleeting deficiency of blood somewhere in your heart or myocardial. Typically, when that happens, that could be like symptomatic of your cells being weakened, because if that happens frequently and your cells aren't getting the nutrients they need, they may weaken. However, a decent amount of time, that kind of thing is usually misdiagnosed as heartburn, especially in women, because feeling something like heartburn or anxiety is a heart attack symptom in women, which is typically not addressed when men have a heart attack, because men tend to have the more, what we know of as, like, manly symptoms of a heart attack, the pain shooting up the left arm. That doesn't always present that way with women. I would strongly recommend looking that up, because there is new research to dictate what new symptoms of heart attacks in women are and are like. And there's a reason why heart attacks are misdiagnosed in women more frequently than men, simply by nature of the fact that the signs of a woman having a heart attack tend to mimic anxiety more than a man's, so it's misdiagnosed more often. Right? And this gets into congenital heart failure, which is see, we have blocked arteries here, coronary artery disease. This is what your normal healthy section of our artery should be. This is a cross-section of it. Sometimes you'll end up with a tear in your artery wall, right? As your body attempts to fix a potential tear in the artery wall, that could cause issues. If fatty mineral deposits or cholesterol build up along the inside of the artery wall, that's also bad. If a blood clot forms somewhere in there and ends up blocking the way, there you go. That will, cut off blood flow, cause angina pectoris or chest pain and can lead to either atherosclerosis if these cholesterol or fatty mineral deposits harden, or like those blood clots or thrombuses can cause a heart attack if it completely cuts off your blood flow. These kind of issues can be compounded with other issues, like some people are just genetically more likely to have this kind of thing. My dad had low blood pressure, but he was a tall and large man who was over 6 feet tall and on the heavier side, but he had low blood pressure. My uncle, on the other side, if he turned sideways and stuck out his tongue, you would think the man was a zipper because he is so scrawny and lanky. However, he's had 2 triple bypass surgeries. Like, they're brothers. Like, same genetics, right? But one of them got, like, the short end of the genetic stick. Smoking also impacts this because smoking can affect, like, your arteries and that sort of thing. And atherosclerosis, how flexible things are. This is one reason why people who smoke not only have lung problems, but they also are more likely to develop heart disease. Excessive alcohol use can also damage your arteries. Diabetes can, so can severe stress that's prolonged, or lack of exercise if you are lazy, right? Like, this criticism right there with the lack of exercise is probably my biggest flaw in this list. Things, because I don't smoke. I'm not a stressed out person generally. I don't think I have the genetic issues, but like, I don't exercise enough. I will openly admit that. Treatments for whatever is causing your coronary artery disease are going to vary based upon what's causing it. Genetics, you may just have to mitigate some of the damage and figure things out, right? If you are a smoker that's amplifying this, just quit smoking. If you're an alcoholic that's amplifying this, you may have to start going to AA. Diabetes, you're going to have to keep your insulin and your diabetes better in check. That kind of thing. Lack of exercise, start exercising a little bit more. That kind of stuff, right? Maybe combinations thereof. Treatments are going to vary based upon the root cause of the problem, not necessarily what is causing the artery disease, right? All of this can lead into congestive heart failure, right? Which is basically a progressive condition where your oxygen in your blood is so low that the blood circulation is inadequate to meet your tissue needs, right? So congestive heart failure means your heart is giving out slowly but surely. Over time, it can cause issues that can eventually lead to death. This could be caused by a number of things. We were just talking about coronary atherosclerosis with your arteries. That impacts and affects coronary, like, congestive heart failure. If you have persistent high blood pressure, that's also going to compound with your coronary artery disease. If you've had multiple myocardial infarctions, so you've had multiple heart attacks, that's going to affect your congestive heart failure, potentially put you into it. If you have something called dilated cardiomyopathy, right, meaning vessels and other things like that are dilated in your heart where they shouldn't be, that is going to affect all of this kind of stuff. But inevitably, congestive heart failure means that your things are giving out in your heart to the point where it is not meeting your blood supply needs and adequacy. And eventually you could die from that. Right? Bradycardia. Right? These are the next 2 things I'm talking about are called arrhythmias. Arrhythmias are heart rhythms that are irregular. They're either too slow or too fast. Both have their own sets of problems. Bradycardia is the first one that we are going to talk about, and that is an abnormally low heart rate. Generally speaking, you can be diagnosed with bradycardia when you have less than 60 beats per minute, meaning your heart is beating fewer times than once per second. It definitely becomes an issue if you hit less than 50 beats per minute, right? Usually, That may not be as significant as other issues, unless it's persistent and you have other problems compiling on top of that, such as your bradycardia is causing you to have low blood pressure to the point where you are passing out, or when you faint, when you go from like lying down or sitting down to standing up. If your blood pressure plummets, if your blood pressure is low anyway, and your blood pressure does tend to fall a little bit when you stand up, if your blood pressure is low enough to the point where when you stand up and it lowers that extra bit more, you pass out due to lack of blood flow to your mind, that is a problem that needs to be addressed for your health, right? But remember, this is also going to be conditional upon other things that are healthy in your body. If you are a trained Olympic athlete, nobody's going to bat an eye if you have a slightly lower bradycardia heart rate. However, if I suddenly developed bradycardia and I started like getting woozy or passing out when I was standing up from my computer chair, there may be a couple of issues, right? So this one is very, how is it affecting your life? Is it an actual problem or is it caused by excessive fitness kind of deal? Right? Tachycardia is what we normally worry about more often in this country. Right? Bradycardia, I might add, could also end up being caused by malnutrition. So if you end up working with an organization such as Doctors Without Borders and that kind of thing, if you are doing healthcare work in other nations where people do not have as easy access to food and water, you may encounter more bradycardia because of malnourishment, right? So, like I said, this could just be because you're a super healthy athlete and there's no problem involved. It could be caused by other problems, and additional symptoms could be present because of other factors such as malnutrition. It just all depends upon context and what's happening here, right? Tachycardia is the problem that we tend to see more often or not in the United States. Tachycardia is the opposite of bradycardia, where you have like abnormally high heart rate. So your heart is beating too fast. Usually this is diagnosed when your heart is beating at more than 100 beats a minute. Right, so your heart is beating more than 100 times a minute, which is pretty fast. More often than not, tachycardia here is associated with things like extreme stress or pregnancy, right? It can also be like other conditions may impact this, right? If you are unfit enough to the point where your heart is just trying to beat over and over and over again, and you develop tachycardia because you're not used to exercise and you're unfit, that can be an issue. If it's associated with pregnancy, they're going to look at a whole host of things like how is the baby? Are you close to giving birth? All that kind of stuff. Right? If you're stressed out, the issues here are, do you have tachycardia because you wanted to seek a thrill and you went into that haunted house and you're still kind of jittery from it? Or do you have high blood pressure because something is triggering your adrenaline fight or flight constantly because you are in a high stress work environment, having to work like constant back to back to back to back to back shifts because you decided to join the military and you are in Iraq? Do you now have tachycardia because you've been awake for a 36-hour shift when you're being shot at, right? So we're talking like extreme stress versus this. What symptoms would you expect from this, right? If your heart is beating that quickly, does it have adequate time to fill with blood before it's beating again? Probably not. If you are not as fit of a person, this is going to affect you poorly, right? So if you are less fit, this is going to impact you more negatively than otherwise. If you are an individual and this is affecting you due to extreme stress, they may want to take you out of that stressful environment. If it's because of pregnancy, they may put you on bed rest for a little while to see what's happening. right? If it's because you need to exercise a little bit more so your heart gets used to like the strain of pulling your own body weight, that means you may need to go on a diet and exercise a little bit more, right? All of this is situational, right? And then you have a couple of other issues, right? Ischemia. That is a fun word. It's Ischemia. Is a fancy term for decrease in blood supply for whatever reason, right? So you may have ischemia here, right? You don't know why. It's for whatever reason. All we know is that blood supply is low because of the ischemia. Your cardiac muscles, remember, have more mitochondria in them to keep them pumping. That means your cardiac muscles need more oxygen than like the muscles in your arm or your legs, right? If cardiac muscles are deprived of blood and oxygen, the cells end up using anaerobic respiration, which is going to produce lactic acid, which will then sit on top of the heart. That increased acid or hydrogen sitting on top of your heart means your cells are not going to produce the energy or ATP that they need, right? Blood is going to become more acidic. We've already talked about how that lowers how contractile your heart muscles are. That's also going to mean that gap junctions around your heart are going to close. It may cause cells to damage. That could lead to like nerve impulses or action potentials not being good. Your body may need to start trying to build a little artery around a blockage to continue to supply blood supply to that area. For whatever reason, ischemia just means that blood supply lowered for whatever reason. Right? And then, sadly, we have to talk about congenital defects a little bit. Congenital defects are heart defects that you are born with, right? There are ventricular septal defects. That means sometimes the septum, the interventricular septum that is between the two ventricles, doesn't fully form and there may be a hole in it, right? That's bad because that means oxygenated and deoxygenated blood from the right and the left sides of the heart can mix. That's not good for anybody, right? That's going to require surgery in the infant to fix. Coarction of the aorta means that the aorta didn't fully develop fully wide enough and that it narrows at a point. That can also negatively affect things like blood pressure and the child or fetus's ability to pump blood well, right? There is also something called the tetralogy of fallout. That means there are 4 major problems with the infant's developing heart. The first of them means the pulmonary trunk is too narrow, and the pulmonary valve doesn't develop well, so it's already stenosed as a fetus or as a newborn, which then results in a a hypertrophied right ventricle because the right ventricle is getting blood flowing into it plus blood backflowing into it from the pulmonary trunk, meaning you're going to have an overextended right ventricle, which is not good. And that is going to put pressure on the interventricular septum, which is going to cause ventricular septal defects to form. So that middle septum, once again, is going to deform and not be good. Which, as we remember here, your aorta connects right here at the... It connects to the left side, but it's also kind of touching where that interventricular muscle wall septum here goes. During the tetralogy of fallout, sometimes that interventricular septum starts to bow out into the left side, meaning that aorta opening can sometimes end up being open to both ventricles, which once again means you're going to have a mixing of blood. You're going to have blood going into the aorta from both sides. Bad things are going to happen to the poor kid from there. That is not a positive outlook or outcome for the child. They're going to need corrective surgery to fix this. Right? Your child will need like potentially a heart replacement. It's not a pleasant surgery to think about a baby needing, right? Heart objective number 19 is describing how age-related changes to heart functionality, which is the last thing we need to talk about, right? So your heart is a muscle. It's going to do the exact same thing that all the other muscles in your body do as you work, right? You have normal changes to the heart that are going to include some aging pigment called lipofuscin. So your heart is going to slightly change colors over time as you age, right? Just like every other muscle in your body, your heart muscle cells are going to degenerate slightly over time. The valves inside the heart, which you remember control the blood flow and make sure things don't start backflowing, may end up getting thicker and they may get stiffer over time, meaning they can't do their jobs as well, right? So elderly people have a tendency to develop a heart murmur caused by valve stiffness, which is fairly common. Remember something along the lines of, like remember when we discussed heart valves oh so long ago, right? When we talked about your heart valves forever ago, and we did talk about your, like, there we go. And we talked about like aortic stenosis and things like that. About 40% of the population of the United States that is over the age of 80 has aortic stenosis, right? This affects the elderly. In addition to that, your arteries and arterioles become less elastic because everything stiffens up and gets less elastic as you get older. Meaning your arteries and your arterioles are not going to be able to relax as quickly during diastole between the rhythmic pumping of your heart. And as a result of that, your blood pressure is going to increase every time the heart contracts and stay high, which is sometimes going to make your blood pressure during systole above normal. And that's going to be a problem because blood pressure will stay higher in elderly people than it does in normal or like younger people, simply because the heart cannot relax in a timely manner, or the blood vessels can't relax in a timely manner. This is going to cause our elderly population to have a little bit of a higher blood pressure problem than the younger population. This could pose other issues along with high blood pressure and that kind of problem to them. Right? And there you have it, guys. Everything you need to know and all of your objectives about the heart. Have a wonderful, wonderful day.